Hello and welcome to this edition of Bayou Time. I'm your host, Keith Whiteside, licensed clinical social worker. Thank you so much for joining us. However you may be joining us, we appreciate it very, very much here at HTV. And we're always glad to get updates, especially when we can go directly to the source to get some updates about what's happening with our situation over at the Capitol. We welcome back to the program State Representative Beryl Amedee. Beryl, welcome back to the show.
Thanks. It's always a pleasure to come on.
We appreciate you coming to us from the Capitol. And so speaking of, if you could maybe give us some updates about how things are going with this particular session.
Sure. Well, the session started on Monday, and we're moving forward. On Monday, the House read in about 810 bills, and so they've got their first reading, and now they can be processed and begin moving towards committees. And the Senate did the same thing with just a little bit less number of bills. And one of the big topics right now has to do with there is a governor's veto that's looming, and we are still working on all the logistics about how that would work. We are currently in session, and according to the law, whenever there's been a veto and we're not in session, when we leave session actually, there's automatically a veto override session set for 40 days later. And should the governor veto anything, it's automatic unless a majority of both the House and the Senate turn in a ballot that says we don't think we need to override anything. In that case, it's canceled and we don't meet. Well, 40 days from the end of the last session is right in the middle of this session. And so what we figured out is if a majority of the House and Senate do not submit ballots saying that no override is necessary, what we will probably have to do is pause this session, which is similar to when we just finish like on a Thursday or Friday and go home for the weekend. It's sort of an adjournment, but not sine die. And then we will hold an override session. And after a couple of days, we will come back into this session in progress. And that would mean that we don't have to end the session and then start all over filing all these bills again. It's simply taking care of business on a few days that we take off of this session. So right now, we still have several more days for the deadline for submitting our ballots concerning a veto session. And we will have to wait and see what happens.
Is there a particular majority vote that needs to take place in both the House and the Senate for that to happen?
It would be a simple majority of the House and the Senate to say that we do not need an override session. Now, of course, the two bills that we would be considering are identical bills, and they are both the congressional maps that we passed out during our special session on redistricting.
Right.
And so that's what we're looking at right now. Whether we're going to go into an override session or whether we will not. And if we do not, then that map has been vetoed and we would currently have no congressional map. And at that point, I believe the courts would have to take action.
Okay. And so I know there's only so much that we can talk about as with regards to that, but that's just kind of the procedures that lead us up to that point. And I find it very interesting that 40 days lands right in the middle of the next session. So isn't that interesting?
It is. It's rather unique, but it's because the regular session is automatically scheduled by law. I mean, the law dictates when the regular session each year takes place. We just happen to have had a special session this year shortly before. We had a 3-week break in between, and that's just how the calendar falls out.
Yeah. So it's just kind of interesting how that happens. We appreciate you explaining that. What's been the feel with those 810 bills so far? Is that a standard? Is that higher or lower than you would normally see during a session like this?
I think it's a little bit higher than usual. I've predicted all along that this session, when it's all said and done and all the bills that are going to be filed are finally filed, that we will see a record number of instruments, whether it's a regular bill or a resolution or what have you. And that's because we have some leftover bills. If you remember, in 2020, the legislature took a break from session because of COVID. And when we came back into session, it was sort of a condensed session. And
Right.
we didn't hear all of the bills that had been filed that year. We only heard the ones that were very urgent or that we could bring forth without expecting a whole lot of people to come to the Capitol under the COVID restrictions at the time. And so some of those bills have been brought back this year as new bills because none of ours automatically roll over. And in addition to whatever bills would normally have been filed under normal circumstances, we're going to be handling some of those leftover bills. And I believe that's going to cause possibly an unprecedented number of bills. But as of right now, we haven't broken any records that I'm aware of. We often handle about 1,200 bills per session. And so I'm just thinking that we may go above 1,500. As you know, now that the session has begun, each legislator could bring as many as 5 additional bills. Now, they're not going to, but that does mean that we will see a few more.
Wow. Well, as we kind of close in this first particular segment, it's rather remarkable to try to wrap your head around 1,200 bills in such a short period of time. But it makes sense about those bills kind of being pushed over. And there's probably some extra bills there with regards to how large hurricanes have impacted and affected certain areas. So that probably makes a difference as well.
It really does. Between COVID restrictions that we've experienced for 2 years and the hurricane experiences we've had for a few years now, the insurance committee is going to be very busy this session.
You know, we're talking about that rather large number of bills, and it's hard to wrap our head around 1,200 of those. But like you've got 14, right, that are pending, and then there's that option that we could have more. Is that right?
That's true. I've already filed 14 bills, but there are at least 3 more on the drafting table, and so I could possibly bring 5 more bills in the next 2 weeks.
Yeah.
We're still working on it.
So anything that you would feel that would be necessary to add, and we appreciate that. Can we kind of talk a little bit about some of the ones that you have proposed and what they're about?
Oh, yes, sir. Of the 14 that I pre-filed, I would have to say that half of them have something to do with immunizations. And that's partly because of what we experienced for the last 2 years with the COVID shots. But I had already brought a few bills in the past related to some aspect of immunizations. And because of what we've learned now, I'm revisiting some of those in addition to the directly inspired, COVID-inspired bills. So I'll tell you about a few of those.
Okay.
Let's see. Okay. One of them is House Bill 407, and this one says that a vaccine that is under emergency use authorization cannot be added to the list of vaccines required for school and daycare. As you know, the COVID shots in the beginning were being recommended, but they had not been fully FDA approved. And at first, they approved the shots for older people, and then gradually they brought the age down. And as we approached school age, people were very excited, hoping that children could also get the vaccines, but they weren't FDA approved initially. And even now we see that there may be some problems, especially with younger children receiving the vaccines with all the potential side effects. So this bill simply says that as long as a vaccine is under emergency use authorization, it cannot be required. And that's because it's still in the experimental stage at that point. So that's House Bill 407.
Okay, and that would be a differentiation between emergency use versus FDA approved for long-term use. Okay.
That's correct.
Okay.
Because the FDA approval process actually takes years.
Yes.
And by the time it's fully approved, you have data and statistics so that each individual will know or can better decide whether this shot is one that they should take or one that they need to avoid based on their own conditions and their own risk factors.
Sure. Thank you. Thank you for qualifying. So the other one you said.
Yep. The next one that's similar is House Bill 427. This one prohibits the administration of immunizations to minors at school, except where there's a school-based health clinic. And as you remember, a few months ago, the State Department of Health issued an invitation to schools around the state, or school districts, I should say, to bring, let's call them mobile vax units. Basically, if the school was willing, the Department of Health officials would have healthcare professionals show up at the school and administer the COVID shots to students or staff, anyone who was willing. Now, the students could only receive these shots with parental permission. And if you followed the headlines, there were a few students around the state who ended up getting the shots without parental permission. And so now there are lawsuits. And so school superintendent spoke with me and said, can we just stick to educating and let parents handle health care issues outside of school? And so the bill would prohibit giving students shots at school, except where there's a school-based health clinic, in which case the parents are already aware that health care is being offered, and they've already, at the beginning of the year, signed a list of what healthcare procedures their child may have and which ones they would object to.
Okay, is that specifically just having a nurse there at school, or is it, does the clinic itself have to be more in-depth than that?
A school-based health clinic is a bit more involved
Okay,
than simply
I
having
figured
a
it was.
It is.
Okay, all right, very good. Thank you, Beryl, for clarifying.
And let's see, another one is House Bill 428. It simply prohibits Bessie or the Department of Education from recommending any medical procedure or vaccine. And they really don't right now. That's left up to the state public health officer, and that's where we would like to leave it. So this simply clarifies that it's not the job of our education experts to recommend healthcare procedures. We're going to leave that up to the medical experts. So that one's House 428.
So 428 would simply say, let's just do what we've been doing. Let the schools focus on educating, and let's get our recommendations from the governor's office, let's get recommendations from the CDC, and those can be kind of dictated by there, rather than people who are experts in education making recommendations or suggestions about what people should do with their health care.
Right. Our state laws say that the public health officer with the Department of Health makes these calls, and we would like to clarify that we're going to leave it that way.
Okay. Well, Beryl, we only have a few seconds left in this particular segment and kind of want to talk about the rest of those, but it sounds like 407, 427, and 428, all of those bills that you're recommending, all are about either immunizations or health care, and making sure that there's good clarity with regards to who can or cannot get those immunizations and who is providing that, and making sure that the teachers and the schools themselves and the Bessie board kind of takes care of students and education rather than health care, if that's a good summary. When you've got the number of bills that y'all want to review, it kind of calls for some long days in these sessions. So thank you for joining us.
Sure, my pleasure. And the days may get longer as the committee meetings begin to handle what we call the more controversial bills. They usually start off with what they consider to be simple bills.
Right.
And so about mid-session, things get really stressful, and the meetings get really long and sometimes contentious, but we hope to avoid that this year.
Right, right. And so I know we've, last segment, we were able to talk about some of the bills you recommended, 407, 427, and 428, all kind of related to schools, immunizations, and who is doing what. What are some of the other bills that you are focused on that you really hope will get passed here in session?
Well, always, I hope all of my bills get passed, but a little bit of variety here. Let me touch on a few. We have House Bill 299, which creates an exception to the open meetings law for local government bodies. It's an exception that the legislature already has in law, but we found that it would help local government bodies to be able to be on the same Zoom call or in the same meeting right after hurricanes, for example, whenever there's emergency information going back and forth. And this way we can keep the OEM director from having to have multiple phone calls just to catch the whole parish council, or in other parishes, the whole police jury or city council. It would allow the members to be on that same call or in that same meeting without having to worry about whether they've reached a quorum or not. Because in that meeting, there's no voting, there's no polling of members. They're really just discussing sensitive emergency information in the emergency itself as it's going on, or right after the emergency event. So that's House Bill 299. Another one on a different topic, is House Bill 356, and it concerns the education right of parents to access and examine lessons. Right now in law, we already have 2 sections of law that say that parents have the right to access instructional materials and school records and look at textbooks and even computer software that's being used to teach their children. This bill simply adds the word lessons. Parents would also be able to request to examine the lessons being used to teach their children. Another bill is House Bill 396, and this one concerns SNAP benefits. Right now, Louisiana is under a waiver of the federal work requirements for eligible SNAP benefit recipients. The federal law currently says that those who are receiving SNAP benefits who are between 16 and 59, except if they have a physical or mental handicap that makes them unfit for employment, or if they're caring for a small child or someone who's incapacitated, those people would be required to work, look for work, train for work. And at this moment, Louisiana is under a waiver where none of those requirements apply. Now, we've been under such a waiver for about 20 years now. And the way we receive this waiver is that the governor asked for it. And this bill would simply say that when it comes time to consider renewing this waiver, if the governor wants to apply to continue the waiver, the legislature gets to weigh in. And this would allow for a little more oversight, a little more transparency, and possibly some public input in the decision as to whether to keep us under that waiver or not.
That's a really important bill, I think, because what it does is it says that we need, if those people need help, we need to keep qualifying that they are at least looking for work if they're able or capable of doing so, right?
That's right, especially in this time where we're seeing a huge number of jobs available and they're not being filled to the point where some businesses can't even open because they can't be fully staffed. So obviously there's plenty of work out there, and so that federal work requirement only applies to those who are able-bodied and ready and eligible for work, not people who are incapacitated or taking care of small children or others who need care.
Yeah, really cool. Very good. We got about 1.5 minutes left. I want you to be able to share with us some of those other bills.
Okay, I'll do 2 more.
Okay.
House Bill 499 is a bill that would actually fund something that we've been having in law since the 1990s, and that is people who are 55 and older are supposed to be able to go to college for free, tuition free. We've never funded it, so this is an attempt to begin funding that.
Oh, wow.
And here's my favorite.
Okay.
House Bill 594 and the companion bill 596, which is the constitutional amendment portion. It's a bill that protects bodily autonomy, and this is a bill that says that each individual has the right to make their own health care decisions, that the government cannot require you to have any particular health procedure, including immunizations, if you don't want them. So I'm hoping that all these pass.
Wow. And that's a lot of them. Like you said, about half of them are related to immunization. We kind of started there and kind of finished there. And just, you know, it's kind of interesting. The Patient Self-Determination Act of 1984 kind of gave all individuals the right to say what they do or don't want at the end of their life. And this kind of says, in this world of immunization and discussion of immunization, that people can decide whether they do or not want that based on their own preference about getting an immunization or not.
That's right, or any other healthcare procedure.
Right, any of those. Beryl, we cannot thank you enough for your time coming on with us. Thanks for the clarification, and thanks for thinking up some bills that will really make a difference in the lives of the Louisianians whom you be able to stand for and represent up there.
I'm happy to come back later in session and give you some updates.
We appreciate it. Thanks so much, Beryl. Again, State Representative Beryl Amedee from the Capitol. And that will do it for this edition of Bayou Time. Don't go anywhere. A whole lot more local programming when HTV continues.